Prominent and prevalent. It causes divorces, it causes dysfunctional families, it causes abuse, it causes arrogance, ignorance, and animal reptilian behaviors. Okay? That's what this does. Even though you think you're having fun. You want to sedate someone? Give them alcohol, give them ethanol. Common symptoms, as you can see, loss of muscle, just like someone said, sarcopenia, loss of muscle. Why? It's got nothing to do with the neuromuscular junction. People are going to talk about locally. Nothing. They're called muscarinic receptors. And it's cortical representation. Just like ALS, upper motor neuron lesion. There's no lesion here. It's in the brain. When your cortex degenerates, your whole body degenerates. So that's what's really going on. 50% of all your neurons and neurotransmitters, they're firing GABA. GABA is very important. NMDA receptors are very important. Sodium, potassium, calcium, pre and post. Inability to make new memories, anamnesia. So now they've got retrograde and anterograde amnesia. They can't look into the future. Whoever wants my presentation, please come, bring me a USB. Free of charge, you can have it. Okay? Or just send us an email. And the most thing is confabulation. Confabulation means they're constantly confused. They cannot tell what reality is. They're talking to you, but they're not in the now. They're not making sense of what they're saying. Okay? Confabulation. Double vision and hallucination. And we call it Wernicke's encephalopathy. It's an encephalopathy. So your brain is degenerating. Neurotoxicity in the brain. I heard someone talking about giving someone nitrogen, like a Viagra, or nitric oxide. You don't want nitric oxide in your brain. I'm very sorry. That is the most toxic thing that does to your neurons. Okay? When you talk to brain specialists, get nitric oxide out of the brain. That's the first thing we give out. The blood-brain barrier. Now, while you're drinking alcohol, 1 or 2 drinks a day, B1 deficiency goes down. What is the energy that crosses the blood-brain barrier? It's glucose. It's ATP. Now those tight junctions are broken. Your filters in the brain are not functioning anymore. And so you're more prone to degeneration. In the acute phase, confusion ataxia. Almost everyone that comes with back pain to me, almost anyone that comes with neck pain to me, which is chronic, they've got some form of PTSD or some form of dopamine addiction behavior, reward behavior, which is alcohol. You can be doing all your treatments there, great, but they're not going to get better if you don't address this issue. They're addictive behavior, dopamine. And, of course, severe memory and difficulty with learning. This is the brain. Not many people know how to read MRIs. Radiologists don't even know how to read MRIs. When it comes to encephalopathies, they can pick up tumors, they can pick up ischemias, they can pick up edemas, they can pick up plaques, but what are you measuring here? How thick is your pyramidal tracts? How thick is your grey matter? Anyone knows? How thick is the grey matter? It has 6 laminar layers with a pyramidal tracts. How thick is it? 5 millimeters. Imagine when that degenerates, what happens in there. Okay? And there it is, the whole cortex. And what's here where the black area is, these are your sinuses. This is what drains the blood. That's why the CSF, the endolymphic system, is important. You need to be sleeping. That's why people who work at night shifts, police officers, doctors, nurses, have high prevalence of dementia, high prevalence of obesity, high prevalence of cancer cells, senescent cells. Now, let's see the presentation, how this gentleman comes. That's him. That is him. He can't stand up. He's confused. No motor control. He's been in and out of rehabilitation centers. Look at him. He can't even perform a Romberg test. He's like an ape. Flexor response. His one son gave up on him. You know why he's like this? He represents beer. He is the representative of a famous beer company in Cyprus. Kia, it's called. And he drinks with owners of hotels, because Cyprus is a tourism place. So he drinks. He's an alcoholic now. He's an addicted brain. He can't even think. His one son that came to me, and yes, we treated him, had non-resolvable IBS, ulcerative colitis. We did neuromodulation, and he fixed it. I don't use the word cure, because something else is going to pop up in the future. Okay? And that's why he brought his father. Money is not the issue for him. He has 2 assistants, 2 people from India, male, to carry him around. You can't carry him. Now, that's what he's got. Disturbed sleep, imbalance. When people are at the end stage of dementia, okay, you will see their head drop syndrome. It means they're almost dead. When someone with dementia is not eating anymore, has lost appetite, it means the neurons, degenerative, are in the pons going down to the medulla. Good night. They haven't got long to live. He doesn't want to eat anymore. He's an animal. He doesn't understand. He does not communicate. Confabulation. And he's got chronic low back pain. They put injections, microdiscectomy. I didn't even write all those things down. Don't need to write. How many times people come with pre-Parkinson's symptoms, back pain, shoulder capsulitis. They do the surgeries and after 3 years they've got Parkinson's. Thank you very much. Don't operate on MRIs. Don't operate on anything else that is investigational. Examine the patient. And that's what we're going to demonstrate today. Let's see what happened to this gentleman. We're doing tests. Limbic tests. Parkinson tests. Dopamine. Look at him. There's no volume. Of course, no volume. Sorry. So the volume people, volume. Thank you. Volume. There is.
He cannot perform.
Everyone's given up on him. Just one son is taking care of him with 2 assistants. Limbic test. Look at that. Dopamine. GABA. He can't perform. Try treating him now. Look at that. Romberg. He's on the wall. He falls back. Cerebellar. Atrophy. He can't stand. He falls back. Again, midbrain. What's this for? Serotonin. What's this for? Dopamine. Rapha nuclei. Ventral tegmentum area of the brain. It's in the pons. Learn neurology. We've become medical doctors just reading tests and applying things to people. People with dementia, they have no constriction of the pupil. Amiosis, no constriction. So, the primary visual area is deteriorating. How is it going to respond? It's not. Look, it's not reacting to the light. Cranial nerves now. Oculomotor 6, oculomotor 3 and 4. I'm holding his chin up. Follow this. Convergence. You put him in a shopping mall, you put him in a wedding area, public area, he'll get lost. Just like someone with dementia. They can't focus. There's no reference points. We're looking at hypoglossal nerve. He's got fasciculation, cerebellum. 50% of all your neurons are in the cerebellum. Very important, the cerebellum. And if you can't target from here, we can target from the cerebellum and up.
Yes, yes.
So it's like we're doing a workshop now. I have a patient here in front of you and we're doing tests. So we're doing all the neurological tests. He's just saying mumbo jumbo. Blah, 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 blah. Doesn't make sense. Confabulation. I can't do baths. I get stuck. No, look at the research. Now, the most important test is Babinski. Why do we do a Babinski test? So, medical doctors, why do we do a Babinski test? What does that tell us? Anyone here? If the thumb goes up, what does that mean? Where is the lesion? Yeah, exactly. Anyone? What does it mean, Babinski test? Yeah, it means it's an upper motor neuron. It's above the midbrain. And what if the big toe goes up, down, like ALS? I had a gentleman, he came from Australia 2 weeks ago to Cyprus because he was operated by a professor because he had back pain. And then after 6 months, he started having a foot drop, physio, this, that, injection. He calls me up. You know what I said to him? You've got ALS, mate. You have ALS. And no one's picked it up. Even though ALS has no pain. Guess what he had? He went to a neurologist. He found spikes in the EMG. Demyelination. He's got ALS. So he had a spine surgery despite he had ALS. That's what the Babinski shows you. Where the lesion is. Is it upper motor neuron, spasticity, clonus, or lower motor neuron, flaccid paralysis. That's why at SOZO Brain Center, when we train doctors or even physios, the second phase, if they're not aware, I cut them. If they're not well knowledged, we cut them. It's very important to have knowledge and reason. Now, he's got upper motor neuron. I'm going to show it one more time. No, nothing. That's normal. Now we go to this one. There it is. That's positive. He's got an upper motor neuron on the left, which means the right part of the brain. We do neurological assessment. At SOZO, we have software systems. Our assistant, which is just a basic psychologist, she does all the assessments. It takes weight off me. I can do my medical tests, and my assistant can do all that on a software system, because we are evidence-based practice. No more writing down tests and scores. And these are automatically calculated for you. We use a Microsoft-based system that does it automatically for you. So we use a compass test, autonomic. He can't stand upright. Vaso, gastro, secretory. We do brain mapping. It's okay. If you want, I'll just get off the stage. No problem. I'm happy to do that. Okay. So while we're brain mapping people's brains, okay, we're looking at the rhythms of the brains. It's very important when someone is working with executive function, they have alpha rhythms. If they work with default mode, they have theta or even delta rhythms. Here, cognitive decline, dementia. We're doing all the EMG tests. Now we're doing mental health assessment. Depression, anxiety, Bex. These are calibrated automatically. This only takes 20 minutes to do all these tests. And you give it to your patient. And so when they go to a colleague or a university professor, they know you've been to the right place. That's his brain. That is the gentleman's brain. Look at that. Demyelination. That's dead. Dead tissue. Demyelination. Cortical, subcortical, limbic. Atrophy. We use TPS. Yes, we use something like shockwave, but with low, 0.2, 0.25. And I do agree with the doctor here. And I did work in orthopedics. And I know how it is in orthopedic mind, a surgeon's mind. Okay? And yes, this is one study using TDCS twice a day. That's a home device. It's in the Journal of Psychiatry, recent publication. It improves all the scores 30%. And that one was a TPS one. So we did combination. This is what we're doing. Stem cells. We can activate stem cells with device, as Dr. Wolfgang said, and I do agree with him. We can go externally. We don't need to go internally. I know the gentleman that was part of Neuralink, and I do know the problems now with Neuralink, Elon Musk's company, by putting internal mesh and wire links into the blood vessels. And that's what we're doing, using all these biomarkers. And yes, can we regenerate cells? It's been done with mice at the University of Tel Aviv. And I'm very good friend with the Professor Eyal, who did this study. Petros, where do we need to stimulate? I told him where to stimulate. Frontal lobe is king. Hippocampus is queen. Cerebellum is prince. This is where you go. This is a study. And yes, look at this. Sham versus actual stimulation. Hippocampus. And these are mice which they induced neurotoxic effects, alcohol effects, and dementia effects, and motor. There's the patient. TPS. My assistant is doing that. I don't need to do it. I don't need. I only do the last 1,000 pulses. That's the TPS using Neuralink. And it's the patient. He's walking for the first time. Look, no assistance. No back pain, no confusion. That's the power of neuromodulation. Knowing where to target, which networks. There is. He's been like this for 9 years, in and out of rehab centres. Liver cirrhosis like this, if you look at his cirrhosis. Good. He's actually getting arm swing as well. He can get up now, by himself. That's week 4. Look how he's sitting upright. And yes, he can leave the practice. And he can actually put reverse now on the cerebellum. Go back. There he is. And he's out, walking. No other place in the world does these studies anymore. Thank God there's a great team of people in SOZO, both university and both clinical. And that's what we can get. If you're interested in it, you can scan it. There's a booth outside. You can find us. SOZO's very easy. If you type in ChatGPT, SOZO is one of the top 5 in the world right now, along with MIT and along with Yale University. And we're very happy and honoured if you want to join us in your profession. I believe in growing the pie. I believe in uniting all branches of medicine together. And this is where we are. Would you like me to demonstrate on you a simple test? Okay, let's test this gentleman. I don't need to know his name. I don't need to know his life. I don't need to know if he's been raped when he was a kid. I don't need to know if he's been divorced. I don't need to know if he's been bullied. I don't need to know anything about that. Which we know in the Israel Defense Force, PTSD has a big impact on their brains. Okay, come please. So all you need to do is just take off your shoes. Let's do a simple test. Simple demonstration, neurological. And what we do is, we've got a simple tablet where we say left, right. And the AI computes it for you. So even if you don't know too much anatomy and neurophysiology, it does it for you. Okay, thank you, sir. Your name? Ahmed, welcome. Inshallah, let's do this. Come on, bro. Let's go. Come back. So the first thing we do, he's on the stage, is we look how he walks. Okay? Just walk forward and back. Turn around. Walk. No swing on the left. He's starting to have secondary Parkinson's symptoms. This is secondary Parkinson. There's no swing. Vladimir Putin has Parkinson, just to know that, if you haven't picked it up yet. He's got Parkinson. It's got nothing to do with the FSB and all that. Biden had Parkinson as well, besides dementia. It's very common, dementia and Parkinson together. It's an limbic system. So, look at him, how he walks. Come back, please. Just walk up and down the stage. Good, turn. Walk. Keep going, turn. And he's losing his balance on the left. But let's test it, okay? Now, let's do some simple tests. Can I have my hammer, please? Reflex hammer. Okay, as you are. Feet together. This is not more. Just leave it there. Thank you. Feet together. Feet together. Yes. Hands forward. Feet together. Yes. Close your eyes. No visual. Yeah, there's Parkinson. He doesn't know he's got Parkinson. He's not aware of it. I'm aware of it. Picked it up. Just by the swinging. There it is. Tremor. There it is. Tremor. So he's going to have secondary Parkinson very soon. And he's not aware of it. Okay? Thank you. Let's keep going. Romberg test. Just by doing neurological tests. A static MRI is not going to tell you this. Or a blood test is not going to tell you this. Or a CSF test is not going to tell you this. Let's go. Simple test. No, wait. Heel toe, heel toe, heel toe, heel toe. Follow my finger, sir. My finger. Okay, good. This is called Romberg 1. Pass. Ding! Close your eyes. If these areas are not functioning, the visual cortex is working. Now, with your eyes closed, please walk heel toe again. I will grab you, or just open your eyes. You're going to fall. Ataxia. Functional ataxia. His cerebellum now is degenerating as well. It's okay, it's okay. He didn't pass it. Now, he's got mild cognitive, he said to me. So you do a MOCA test, the Montreal test. You subtract 7 from 100. That's what you do. Simple. So what I'll tell him to do, I'll be asking you 100 with your eyes closed, minus 7. And then you tell me the number, minus 7. Then you tell me the number. Okay? Let's go. Eyes closed. If you're going to fall, she'll grab you. Just open your eyes. Let's go. 100 minus 7. Walk. Minus 7. Minus 7. Freeze. Minus 7. Okay, minus 7. Don't hold him. Don't hold him. Okay, stop. That's it. All right. What's happening now? The left dorsal frontal precortex is connecting with the limbic system, connecting with the cerebellum, extrapyramidal, and then spinal tracts. He's doing 3 things at once now, and he's having difficulty doing it. Okay? Thank you. So, automatically, I've put this is wrong, that, in the software. Neurological. Let's go. This one. Thumb and index. Slowly. Faster. 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 Slowly. This is dopamine and GABA with acetylcholine. Muscarinic receptors. Peripheral. Faster. Faster. There it is. Left side. Left side's positive. Here we go again. In and out. Faster. The right hand's fine. The left hand is pausing. You see the left hand? The right hand's fine. Faster. And it's pausing. Left side. Difficulty when he walks. Okay? Don't do any physio onto him. It's not going to work. Go to the brain. Definitely. You'll get some great results. Next one. As you are. Okay? Glabella test. Keep your eyes open. Look across. Try to keep your eyes open. They shouldn't close. 3 out of 5 means not producing dopamine. Positive, 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 positive. I've got dopamine. Simple tests, neurological tests. Of course, we do orthopedic tests as well when we've got the table. Next one now. Here. Open. Open your hands, one side. Open the hand, the other side. Okay, now keep it in front. In front. Yeah. Open. Gently bring it back. Open. Gently bring it back. Let's go. Good. Okay, so you see at the end he's got some kinetic tremor. Now we're doing cortical. You've got dementia, cognitive say, mild cognitive. Okay? And we do this test. Now we test, no, keep doing this. He can't keep his hands stable. He's doing this. The neural network's not connecting. The neural networks. Okay? Good. Next side now. Right side is ADD, ADHD. Right side is addiction to porn, addiction to being a professor. Give me more grandeur in this world. It's an addiction. ADHD. Addiction. OCD. Schizophrenia. Bipolar. Left side, depression, anxiety, cognitive decline. Let's do the other side now. So this is the left part of the brain. Left. Stay. Left. Let's go. No. This one. Open and close. No. Like here. Open and close. And we do this. Okay, he's bringing in the planes. There's no connection. Okay. And from there, we do other tests. We do visual. And then we send him for further examination, map the brain, and we give him a program. We either stimulate the cortex, depending what we find, or the brainstem. Give him a clap. That was a small examination. Thank you, sir. Come to our training. We're in Austria in 2 weeks. Okay, so thank you very much for the workbook. I don't know what that means. I don't know what that means. Yes, he will later demonstrate in his talk a few patients, okay, how we deal with them, cases. Thank you very much. This is the field of neuromodulation. Thank you.
Teşekkür ediyoruz.